Nearly half of Americans at least 60 years old visit the emergency room each year, and with the population of older adults increasing, one health approach suggests addressing age-related health issues before they even start.
Yeah, it's called age management medicine. Family physician and functional medicine specialist Dr. Tamika Henry joins us now to talk about it. Good morning, doctor.
Good morning.
Thank you so much for being with us. So
Good morning.
Yeah, so we are excited to talk about functional medicine. How did you discover it and what is it?
Well, functional medicine, I discovered as I went through my career and started looking into different aspects of how can I do something that prevents disease before it starts. And I looked into some of the health pattern issues my family was having and friends were having, and I started to dive a little bit deeper. And I stumbled upon this medicine of functional medicine. I'm like, wow, I think I've been doing this all along. So basically, functional medicine is sort of like getting to the root cause. It's when you think about a tree, you want to prune the branches, but really you want to get beneath the surface to the roots and really figure out what's going on beneath the surface.
What is the key difference between the age management medicine and functional?
The biggest difference that I see is that there's a lot of similarities overall in the fact that we're looking at genes, we're looking at environmental stressors, we're looking at what's going on genetically, what's going on with your sleep, your hormones. So there's a lot of overlap. They may do a little bit more of advanced testing as it relates to regenerative medicine and telomeres, but functional medicine has its own form of specialty testing.
And how do you take a root cause approach to a disease, something like diabetes, for example?
So diabetes, if we think about diabetes, most people think of it as a blood sugar disease, but it's not just a blood sugar disease, it's a blood vessel disease. So what we're looking at is inflammation to the blood vessel. So how do we get to what's causing this? So we're looking at gut health. Like if you're thinking of there's bacteria, too much of this, too little of that, and that can cause problems like bloating, diarrhea, constipation, or if you're not sleeping, that can cause you not to rest, break down your immune system. And then now you're having more problems with inflammation. And then we'll go into stress. All of us have some form of stress, but how we respond to it can lead to chronic disease.
All right, so those are the typical risk factors for diabetes?
Oh, definitely. I mean, we're thinking about like if you have your sleep, what you're eating, hormonal imbalances, environmental factors. But these risk factors, I want people to understand that they're modifiable. And we think about genes. You know, people think, well, this is in my genes, so this is going to happen to me. I want you to understand genes load the gun. It doesn't pull the trigger, which means you can do something about it as far as making small little changes along the way.
That's a really great metaphor. Let's talk about another age-related illness and the root cause approach. Let's talk about cardiovascular disease.
Now, this is a big one, Lauren, and I say this because it's the #1 killer of men and women. And what we don't realize is that it goes back to inflammation. So when we're thinking about the foods that we're eating, we're thinking about the lack of sleep, we're thinking about our genes, we're thinking about what we're putting on our skins. You know, women, we like motions and potions to tighten it up. But what's in those motions and potions? It can be infecting us at our vascular level. So taking the time to calm inflammation down and looking into sources as into gut health, hormones, sleep, food, movement, it all plays a role.
All right, so what do you recommend we do to prevent these conditions?
So this is a great question, Pedro. And I say this because people are so overwhelmed by it. There's so much going on. I don't know what to do. Let's just keep it simple. And I give you the basics. So that's a mnemonic for you. B, look at your body. What are you eating? How's your sleep? Are you moving? A, how's your attitude? If you're thinking that you're not going to get better, then you're not going to. So let's change that up. S, what's your support like? Are you having some mental health support? Do you have a therapist on board? And then we look at I, what's your immune system? How are you working on improving that? C, your community. Who's your functional medicine doctor? Who's your primary care doctor? Who are the people you're hanging out with? And S, how are you doing with your supplements? And supplements should be just that, supplemental. They're not the end all be all.
All right, and just give us your overall tips for living a healthier, longer life through this lens of functional medicine.
First and foremost, have the right mindset, making certain that you know you can get better. Number 2, getting enough rest. The ideal hours of sleep are 10 p.m. to 7 a.m. Getting a well-mixed balance of food on board. And lastly, getting up and move. And I did not say exercise because that's a bad 8-letter word. Get up and move and change things around.
I like it. I like it a lot. Thank you so much for joining us. For more information from Dr. Henry, head to unlimitedhealthinstitute.com. There's the details and Instagram as well. Thank you so much for joining us. We'll have more after the break.